Welcome to the course on Polymeric Biomaterials. We are in week 1 and we are looking at introductory concepts. In today's lecture, we are going to look at words, some definitions. What is common between all these words is that they all start with bio, biocompatibility, bioactivity, biodegradation and biomimicry. So these are words that we often hear. One of the things that we should do early in the course is to get a good sense of what these words mean. So that's essentially what we will do today. So this is just an overview of what we will look at. We will revisit the idea of biomaterials that we saw in the last lecture and then contextualize that with some of the other words that are typically used in biomaterial design, function and performance, namely biocompatibility, bioactivity, bioinertness, biodegradation and biomimicry. So let's revisit the definition of biomaterials. So in the last lecture we saw that it was a material that was intended to interface with a biological system, a complex biological system, to treat, augment, evaluate and so on, some function of a tissue or organ in the body, right? Now we are going to slightly revisit that definition and we are going to look at a different way to understand biomaterials. So here we are defining it as a non-viable material which is used as part of a medical device which is intended to interact with biological systems. So this part here remains the same. This material is intended to interact with the biological system, except now we are putting constraints. We are saying it's a non-viable material and it is used in a medical device. Now, non-viable itself simply means that the material itself is not a living system, but that it will interface with a living system. The other part of that definition has to do with the phrase medical device. As you will see, very rarely is a biomaterial used in today's world on its own. A single material is very rarely used on its own. Even in a very innocuous application, or what would seemingly be a very small application, one is going to look at a combination of materials that is typically required as part of a device to achieve a therapeutic or to fulfill a therapeutic or a diagnostic need. Now, if you remove both these constraints, in the sense you remove the constraint of non-viable material and you remove the constraint of a medical device, what you now see is that the ambit immediately broadens, right? Because you can now have a biomaterial include applications such as growing cells in culture, which is typically done in tissue engineering applications, assaying serum proteins, for example, culturing organs for, let's say, high throughput screening, for example, or even for replacement potentially, and many other applications, right? That's a very important item to keep in mind, because you can have a very contextualized definition of biomaterial depending on how it's structured and how it is intended to perform in a specific application. At this point, it's also useful to introspect on this particular point, which I have sort of alluded to earlier, which is that biomaterials are rarely used in isolation on their own, but are typically integrated into devices or implants. So the interactions that we talk about with the biological tissue or the host are in the context of the final fabricated form and the environment, both of which are critical, right? So it is not just about saying that I have a material that I'm going to use. What is the form of the material? What is it integrated with? Is it a composite? Is it integrated into a device? And what is the environment it is going to be deployed in within the body, for example. So these all aspects are important to think about when we design biomaterials. At this point, we also look at two complementary perspectives. This is something we saw in the previous lecture also, which is to say that you have a biomaterial and then you have the host or the body, which is the biological system, a complex biological system. And we saw that there is a two-way interaction between these two, in the sense that you are implanting the biomaterial into the body with a specific goal in mind to treat, augment, evaluate, etc. But in turn, the body, because it's a living organism, is also going to initiate a series of processes that will in turn do some things to the biomaterial, right? Including remodeling the material in many cases. So it's important to keep in mind these factors and the two-way interactions in terms of physical, chemical and biological interactions between the biomaterial and the body when designing materials for specific applications. So if you look at largely the first category here, this is what we would call the biomaterial perspective, which is largely structure and properties. So you can talk about microarchitecture of the material. You can talk about bulk properties such as mechanical characteristics, especially if you're using it in a load-bearing application. You can also talk about surface characteristics, which is also important for a very different reason, because surfaces ultimately are the ones onto which proteins will adsorb, and the entire foreign body response or the identification of the material as being foreign by the body is initiated based on proteins being able to adsorb onto the material, and that's largely governed by surface properties. And on the bottom, the last three are what we would call the biological system perspective, which would include function and performance. And between these two, we have covered the entire title of the course itself: Polymeric Biomaterials, Structure Properties and Function Performance. So you see, understanding only one of them is only half the picture. For example, in the biological system perspective, you see that the site of implantation, the physiological condition and the host response are just examples of factors that influence how the biomaterial will eventually perform, right? The host response, for example, can widely vary depending upon the type of material you're using, depending on how it has been combined with another material. All of these things will determine things like host response, right? So it's very important that both of these perspectives are well understood, and in this course, throughout one of the themes will be to understand both these perspectives so that we get a good sense of how biomaterials can be designed for specific applications. With that, we will start with the first word, biocompatibility. Now, this word is used quite a bit, very often incorrectly in regular everyday language, so to speak. But the most widely accepted definition of this is the ability of a material to perform with an appropriate host response in a specific application, right? At first glance, it seems like this doesn't tell us much. It seems very broad, very generic, but as you will see, it's a very powerful definition because it encompasses a lot of different dimensions of how biomaterials can be used in specific clinical applications. For example, an appropriate host response has to do with the biological response. This is the biological system or the host perspective that I talked about on the earlier slide. And the effect that this has on the biomaterial is one component of that. And on the other side, you have a specific application. Obviously, you are putting in this biomaterial into the host with a specific goal in mind to achieve an end for some kind of functionality, for example. And that biomaterial property will dictate what kind of an effect it has on the host. This is the biomaterial perspective which we saw on the previous slide. So, here you can now have under a biological response, one example of that is immune response, right. Ideally, when you implant a biomaterial, you want the body to mount an immune response and integrate it with time. Right? If the body does not recognize it at all, that's problematic. If the body recognizes it, mounts an immune response that is not favorable, and then isolates it, that is also problematic. What you want is the body identifies it as a foreign object, mounts an immune response, and with time the type of immune response or the landscape of the immune response changes, which means that eventually this material is going to integrate with the host. One example of that is scar-free healing, where there may be an initial injury or at the surgical site because of incisions and so on, but once all of that is closed up with time, you don't want permanent scars to form, right. So, that is one example of the body reacting to the implanted material, recognizing that a new material has been implanted, but then with time integrating it into itself. On the other side, you have material properties that dictate material performance. For example, in a urinary catheter, you can now think about what kind of properties may be required for a urinary catheter to do its function fully, and by that I mean the properties will dictate how the material performs in that application. What you also should appreciate at this point is, and I would like you to pause and reflect on this point, is typically when you hear the word biocompatibility or when people talk about biocompatibility, the immediate response that people will have, first intuitive response is the material should not kill the cells. But as we just saw, that's a very specific property called cytotoxicity, which may be one aspect of biocompatibility, but biocompatibility is much larger. For example, in an anti-cancer application, you want the medication to destroy the cancer cells, right? And yet that device that is releasing that drug could still be biocompatible. So, you see how these definitions that come to us have to be carefully handled so that we understand them appropriately in a specific context. So, what one sees is that the word biocompatibility itself is very contextual, very application specific, and also has to involve the host response. So, all of these go into making up what we call biocompatibility. Of course, it is also the ability of a material to perform. So, the word perform, host response and specific application all go together to define what we call biocompatibility, which is why oftentimes you will find that one material that has been used in a certain application, right? If you want to use the same material in a different application, you still have to go through the appropriate evaluations for that new application. Presenting evidence from the old application will not make the cut. In fact, in many cases, when the same material is used in a different application, although the material may have been biocompatible in the previous application, under the new conditions or the new implantation site, based on the host response, based on how the body environment is there, all of that will determine whether this material is appropriate for that new application or not. So, as you see, de facto, this word biomaterial is a property of the system itself, which is the joint entity that we talk about in terms of the material plus the host. And it is not, biocompatibility is not an intrinsic property of a material itself. So, it is not very correct to say that a specific biomaterial is biocompatible. As I just said, biocompatibility is a characteristic of a material biological host system in a specific context and an application, and it is not an intrinsic property of the material itself. It is very contextual. it depends on what the application is, it depends on where you are implanting the material, all these factors. What is the nature of the host response? All of these factors will go into determining whether that entire system can be called biocompatible or not, right? Shown here are some generic markers or general markers of what one would consider good indicators of biocompatibility. We are looking at things like blood coagulation, host immune response, inflammatory response, complement recognition. These four are what we would typically call the body's response to the biomaterial. So, we have blood coagulation that happens, then the body mounts an immune response against the biomaterial, which involves inflammation, and then there is complement recognition, and with time the idea is that should go down and the material gets integrated into the host. Of course, if things go wrong, you can always have things like infections in biofilms, which is which you do not want. Tumorigenesis is also not a good thing. Of course, you are also looking for toxicity, right? You also do not want it to be toxic, which is one aspect of biocompatibility, sure, but it is not the only aspect as is typically thought of in common parlance. Also note that these interactions between the biomaterial and the host are time dependent. It is not like the host is going to mount an immune response and that is going to go away with a certain period of time, and then the material becomes integrated into the body, and then there is no interaction at all. The period of interaction depends very much upon the specific context and the application. For example, you can have a catheter, you are thinking of days to weeks, depending upon why you are using a catheter. For example, if you have had a surgery where you are going to be immobilized for a long period of time in the bed, this is one reason, for example, to put a catheter. You can have bone plates that are implanted temporarily, and that could be for a period of months to perhaps several months. And then you can have ventricular assist devices, which is a device that is used to help the heart pump blood to the rest of the body. You might see seniors who have heart issues where the heart does not pump blood correctly, wearing these ventricular assist devices, which is again implanted, right? Part of it is implanted, and that could be there interacting with the host for months to years. For all you know, that patient might require it for the rest of their lives. And something like a hip joint, where you are replacing the entire hip. This typically happens as you age. You are now looking to replace the entire hip joint itself. That new joint is going to stay there for several years now, right? So, the time scale is very important to be determined a priori based on where and what context the material is implanted or applied in. So, this has to be accounted for in the characterization of the material biological host system performance, right from mechanical properties to how surface properties change with time, to how bulk properties change with time. All of these things have to be evaluated over a suitable period of time, depending upon the time for which the material will remain interacting with the host. Now, oftentimes there is a risk to benefit analysis that is done. This is typically done by surgeons who will decide whether implanting something in a patient has more benefits than not implanting it, right? And that can depend on a wide variety of factors, including age, their general health condition, presence of comorbidities. All of these factors go into determining that. So, for example, these heart valves, patients with diseased aortic heart valves have a 50% of chance of dying in 3 years, right? And when you replace the valve, any valve replacement, you are looking at a 10-year survival in 70% of the patients. And there can always be a valve related complication in 60% of the patients within the 10-year period, right? So, now there are obvious risks to this surgery. There are risks to implanting the new heart valve. But if those risks are far outweighed by the benefits, then that those benefits will trump the risks, and then we go ahead with the surgery and the heart valve is implanted. In terms of risks and issues that can occur, right? So these are two examples, one from a host perspective, one from a biomaterial perspective, right? So these are examples of what if things go wrong, right? You're implanting something. What if things go wrong and don't go as planned? From a host perspective, you can have the material being isolated in a fibrous capsule. Now that is not good at all, because what has happened is the host response has been adverse, and the material continues to be recognized as foreign, and eventually it is the body has walled it off, so to speak, in a fibrous capsule. So A, the material is no longer available to do the functions it's supposed to do, and B, you've now created a new problem, right? There's going to be chronic inflammation there and other issues that the patient doesn't want at all. You can also have infection. This can arise from implant sterilization, incorrect or improper implant sterilization, or it can also happen during surgery, right? Either way, this is again infection that has come in a biological system, not the host here, but other biological systems, microorganisms that have gotten into the system and are causing adverse responses in the body, which in turn will have an effect on the host, which in turn will have an effect on the biomaterial, right? So this infection is going to have an effect on the host, which in turn is going to have an effect on the biomaterial. So you see, these things can get very complicated very quickly due to a number of reasons if they are not carefully accounted for at every stage of the design and the deployment. Now, you can now look at the same thing from a biomaterial perspective as well. So here we are looking at two examples. One is metal based implants, where you have leaching of metal ions that can be very toxic. In many of these implants, older implants could have metal ions leaking into the bloodstream, and that can never be a good thing. You can also have mechanical failure of the material, where this typically can happen in orthopedic applications, where a hip implant or a knee implant can loosen with time, particularly a hip implant can loosen with time, and that can lead to issues. So this is an example of what happens if things go wrong. So what you are seeing here is the anterior posterior radiograph demonstrating very severe osteolysis occurring from wear debris. So this is a acetabular cup which has been displaced here, and in the hip, this is a hip implant, and what has also happened is the hip implant has a polymer lining. Now that lining, because of wear resulting in debris, has resulted in osteolysis. So implant wear leading to osteolysis is one example of where things can go wrong with time. Again, there is the key take home message here is there are risks to all of these things. The only question we are asking is overall, if everything is done right from design to surgery to implantation, etc., then there are still risks, but do those risks get far overshadowed by the benefits to the patient? So that's typically what we ask in these kinds of scenarios. Of course, you have these kinds of problems that are unavoidable. There's always a small percentage that will come back with loosening of the implant or other kinds of failure that can happen. But those have to be treated on a case-by-case basis. And with time, if a number of such cases are reported, then it may suggest that there is a deeper problem with the design of the implant itself. And then we will also look at some examples of those as we go through the course. Now, having looked at biocompatibility, both from a material perspective and a host perspective, we next move on to this term called bioactivity. Bioactivity is again a term that we use very often. It simply means, in the context of a bioactive material, it simply means that a biomaterial is designed to elicit or modulate biological activity, right? In other words, it's the ability of a material to elicit a controlled and a beneficial biological reaction. Both are important. The reaction has to be controlled and it has to be beneficial with the contact tissue or host in a diagnostic or a therapeutic cause. So, this is the application part. This is the controlled and beneficial reaction is the interaction part. So, you see right here we see that the host response is again involved, because it is the biomaterial that is acting upon the host, but the response is being elicited in the host by the biomaterial, right. So, that is what we would call a bioactive material. We will look at more examples, specific examples of bioactive materials as we go through, but just a quick snapshot here of some quick examples. One example is bioglass, which we looked at very briefly in the previous lecture. We saw that these are silicate based glasses that were developed largely by Larry Hench, and as opposed to metal implants where they are largely serving a mechanical function, bioglass now can osseointegrate. This is also a term that we have seen earlier, where the material that is implanted can now bond well with the bone. In other words, new bone can be formed around the material without soft fibrous tissue intervening in between. So, bioglass is one example of that, where it has been, it's bioactive because it has successfully elicited a host response, and the bone tissue surrounding the bioglass has been able to, the bone cells have been able to grow, proliferate, and new calcified bone has been able to deposit. So, this is an example of a controlled and a beneficial biological reaction, right. You can also have heparin bonded membrane oxygenators. Heparin reduces platelet adhesion. So, you can have heparin bonded oxygenators that will have anticoagulant properties because of the property of heparin to resist platelet adhesion. So, that is another example of where it is preventing something, but that in turn is having a positive biological effect. You can also have drug-eluting cardiovascular stents. Now, this is used for coronary artery disease, where blood vessels are occluded because of fat deposits, and traditionally metal stents are sent inside and they are expanded within the artery, and that essentially moves the plaque away or the fat deposits away and clears up the artery, and that stent remains there, thus enabling blood to flow through. But the problem there is that with time you can have a problem called restenosis, where cells start proliferating and they form scar tissue, and that's a very problematic thing. So, what you can now do is to have drug-eluting cardiovascular stents that can now release a specific drug with time that can prevent restenosis. So, not only are you solving the problem of the occluded artery right now, we are also anticipating that there can be restenosis, and we want to prevent that by having the material release a drug which will again stop restenosis in a controlled manner, do things that can prevent excessive cell proliferation in that area, thus preventing restenosis and thus having a beneficial biological reaction. Next, we move to this idea of bioinertness. It is not that commonly used, but because we have looked at bioactivity, it makes sense to also look at bioinertness. And remember that these things will be contextualized a lot more as we go through the course. First thing that we want to point out is no implanted material is fully inert, right? One can only talk about optimally inert biomaterials where the host response is just enough to help the material integrate into the body, and then the material elicits any positive controlled reactions from the body, as we saw in bioactivity. So even with what you would call traditionally inert devices, right, that are not intended intentionally to interact biologically. So here we make a distinction between materials that are engineered or intended to interact with the body and to elicit specific responses versus any material that gets into the body is going to treat it as foreign, right? So here these traditionally inert devices such as say titanium implants, for example, do not actively and intentionally interact biologically with the host, which means they are, from a design perspective, they are not designed to initiate specific biological mechanisms within the host. They are primarily intended for replacement or augmentation of mechanical or physical functions of tissue and organs, but not their biological functionality, right? So, for example, a titanium implant can serve as a replacement for mechanical and physical functions of load-bearing bone tissues, for example, but it's not meant to induce bone growth and somehow regain biological functionality. But you can sort of make that same titanium implant biologically active if you want by coating it with ceramic, which can in turn stimulate bone growth and osseointegrate. So you see, what could be traditionally considered a bio-inert material can be made bioactive through functionalization. But again, it's important to keep in mind that no implanted material is fully inert. Whether we like it or not, the body is going to react to materials that you put into it, to different extents, of course, to different degrees. Later on, we will look at what we will call materials that are non-fouling. Those will have elicit a very, very minimal type of a reaction. Some materials could elicit a much stronger response. So as you see, it's a spectrum. But the idea to keep in mind is the body will react to some extent or to different extents to any implanted material. So like I said, examples of bioinert materials could be joint or dental prostheses or surgical meshes which are used for hernia repair, polypropylene PET kind of meshes. Another closely related bio-based word is biodegradation. We've looked at biomaterial, we've looked at biocompatibility, we've looked at bioactivity, we've looked at bioinertness. So we'll move to biodegradation. This completely depends on the context, right? Depending on many factors, right from time scales, which can go from days to years. You can have unintended degradation because of the environment versus engineered degradation. So in polymeric materials, for example, many of the polymers can be degradable and they can degrade into biologically suitable or appropriate degradation products which can be eliminated by the body. There you are engineering the degradation. But in many cases, you can also have unintended degradation due to the material property itself, perhaps it's not the right material for that application, or because of the severity of the microenvironment. Maybe it's a very acidic environment, for example, if you're using it somewhere near the stomach, or it can have very large mechanical loads which you didn't account for when the material was designed. You can also have biostable materials intended for long-term performance where, let's say, you're replacing an entire bladder for patients who have lost their bladder. You can have artificial bladders that are implanted. Now, those bladders will be there for life, right? So, you're looking at long-term performance. You can also have something intermediate where initially, for example, in controlled release delivery vehicles, You will have materials that degrade slowly with time. Again, with the theme of engineered degradation, if you can match the degradation to ensure that the degradation driven mechanism of release is suitable to keep the drug at the therapeutically valid levels, then that would be one example of degradation as well. So, we will look at first the host perspective, which is the uncontrolled degradation. This is degradation that is occurring due to interactions between the host and the biomaterial, but the host now becomes hostile in some sense to the biomaterial, and that is causing degradation. So, these are physiological or biological processes working against the intent of the biomaterial design. So, whatever the biomaterial was designed for, now the host has initiated processes, biological processes that prevent the biomaterial from functioning properly in its working environment, right. Some factors that play a role in determining this include, first of all, we acknowledge that the body has an aqueous buffer, water largely with a bunch of salts at a specific osmolality operated at 37 degrees Celsius, which is body temperature. Now, that in itself can be a problematic environment for certain types of materials. As you will see later, in certain types of polymers, the glass transition temperatures play a very important role in whether the material will behave like a glass or a rubber, and that glass transition temperature has to be contextualized against the operating temperature of 37 degrees. Of course, the body has proteins in the blood which will adsorb onto the material, and using the adsorbed proteins, immune cells will recognize the material as foreign. So, they will come and attach, and they will initiate a series of processes. You can also have acidic pH environments which can be hostile, and you can have cyclic stresses or heavy mechanical loads which can induce over time, not immediately, but over time, over repeated use, over time, initiate processes within the material that will eventually lead to implant failure. So, one example of that is wear debris that we already saw associated with the oxidation of ultra high molecular weight polyethylene in hip prosthesis. You can also have, on the other hand, material perspective which is engineered. You want the material to degrade, but that is because you have a specific application in mind. This degradation could include chemical breakdown under physiological conditions via controlled mechanisms and to result in non-toxic degradation products, right. All of those are important. First one is chemical degradation under physiological conditions through controlled mechanisms, and then non-toxic degradation products. So, here how can you tune biodegradation? You can do it using, at least for polymers, you can do it using a bunch of different ways. You can tune polymer structure and at different levels as well, the microstructure also, chain level, micro level, etc., microstructure, etc., such that you can have a direct impact on things like crystallinity, the molar mass, the backbone of the chain, groups that are sensitive, for example, to the microenvironment. All of this can be tuned and engineered to ensure that you can have the material degrade at a specific rate over time. This may be for a specific application such as a controlled release application or a delayed release application. The last bio word we will look at in this lecture is biomimicry. And largely it is bio-inspired design that aims to recapitulate the structure and or property found in natural systems. So, the broad question you are interested in here is to ask, can I look at what is already available in nature and get inspired by that and then use that and incorporate those aspects or facets in biomaterial design. So, this is also called bio-inspired design. And very clearly there are both structure and property aspects that are involved in biomimicry, and both of those influence the approaches that are taken for bio-inspired designs. One manifestation, one very popular manifestation of that is this idea of self-assembly, where interactions begin with single molecules and then they progressively grow over length scales, building over many levels of what we would call hierarchy, resulting in higher order structures. One very good example of that is this protein called collagen, which we will look at in great detail throughout this course. But collagen is a structural protein found in many connective tissues in the body. Collagen is what helps you use your ligaments, tendons, etc. And the interesting aspect about collagen is there is this idea of self-assembly that happens at multiple length scales, starting from collagen molecules that form a triple helix, then that can self-assemble into fibrils and then fibers, and then collagen becomes part of the tissue, and that happens at multiple length scales. Collagen is also a highly cross-linked protein, and that helps you use, that comes very handy when you try to use your ligaments, tendons, etc., because that is one thing that gives some of these materials their very unique mechanical properties. Collagen also happens to be, or at least some forms of collagen happen to be fibrous in nature. And one example of drawing inspiration from that kind of a structure is this idea of architectural mimicry, where the idea is to look at the fibrous structure of collagen and to ask, can we recapitulate that structure in the lab? And shown here is an example of that, of such a material prepared using this process called electrospinning, which again we will look at in great detail later in the course. But the idea here is you are forming these fibrous materials with fiber size in the micron or submicron range, and the idea is it architecturally mimics the collagen fibers found in the natural extracellular matrices in the body of connective tissues particularly. So the idea is if you can now interface these kinds of materials, fibrous materials, with cells, then there is a higher chance that the cells will recognize them or recognize that architecture and respond to the cues provided therein. Other examples of biomimicry include fibrin glue is an example of that, where we mimic the coagulation cascade to control bleeding. So the natural coagulation cascade itself involves fibrinogen plus thrombin to form fibrin, which forms your clot. Now the bio-inspired design here has drawn inspiration from that to prepare something called a fibrin glue, which can function as a tissue sealant. You can also incorporate functionality into biomaterials using blood derived components. One example of that is this idea of incorporating platelet rich plasma or PRP. That is gaining a lot of popularity now, where the incorporation of platelet rich plasma, which is the blood derived set of components, that can now be incorporated into biomaterials, for example to confer some form of bioactivity, if you will. If you can take a natural component from the blood like PRP and integrate it with synthetic materials, arguably you can leverage the beneficial aspects of both synthetic and natural materials to incorporate unique kinds of functionalities into these kinds of materials. You can also improve performance through bioadhesion. This is another bio-inspired design where people have been looking at muscle-inspired adhesives. Muscles are sea organisms that produce polyphenolic protein that goes by the acronym DOPA, which is a polyphenolic protein, and that helps the muscles attach in the presence of water. So one of the questions you can ask is, can we draw inspiration from these kinds of natural organisms that produce these adhesives and incorporate that into biomaterials for adhesion applications? Before we conclude, I will leave you with this one thought here on the use of DNA origami for biosensing applications. I would highly encourage you to look it up and read more about it. Essentially, it exploits the base pairing rules in DNA and the idea is to see if we can create interesting structures with it that can be actuated based on how they fold, etc., and that in turn can be used for sensing and even applications like controlled drug release. So with that, I hope this lecture gives you a sense of all the bio-related words that you commonly will encounter in biomaterials, and my hope is that you can use this as a base to better appreciate some of the other concepts that we will look at in future lectures.